Hi there. Welcome to Thea's table once more. We've talked about the possible deterring effect of sun and heat on the SARS-CoV-2 virus, but the sun plays another role in strengthening our immune system. A number of my friends have asked me about what supplements they should take to boost their immune system as part of their attempts to avoid contracting COVID-19. Now, supplements are a big topic, and I won't exhaust you with unnecessary chit-chat, but there is some pretty important new data on a couple of supplements that do protect your immune system against this pandemic. I personally do take some supplements for a couple of reasons, but find them to be expensive actually, and not readily available in my country of residence, so I take them very selectively. And some of you might have the same problem with supplements, especially as deliveries from abroad have slowed down considerably. That said, one of the undisputed supplements, and it's one that I've been taking for quite some time now, even before the pandemic, is vitamin D. Approximately 10% of our vitamin D comes from food, and 90% comes from sunlight. So, most people who don't work outdoors could probably benefit from a supplement. If you have the budget for it, have your vitamin D levels tested, but most experts are of the opinion that the majority of people are deficient. Now, this is not brand new knowledge, but some current specific data confirms what I've been reading about for quite some time, and I will quickly go through this in no particular order. Dr. Campbell briefly discussed on April 13 the possible link between vitamin D and the high proportion, disproportionate to the population statistics, of African Americans with severe COVID-19 outcomes. A simple vitamin D supplement could, for example, protect the entire African continent substantially. Now, this bears further research that is, in my opinion, rather urgent. I live in a sunny country, but it's so unbearably hot at the moment that one literally has to take shelter indoors, which means that we also don't make enough vitamin D. On April 21, more details are discussed about the emerging data discussing that the darker a person's skin color, the more likely it is that a person might have a more severe form of COVID-19. This statistic has been evident in the UK and parts of the USA. Low levels of vitamin D might be an explanation for this, as darker skin makes less vitamin D from the sun. If you want to take a look at the data, I suggest that you watch the entire link that I'll leave for you below. A worthwhile link to view in its entirety on this topic is one by Dr. John Campbell on April 15, where he views lots of evidence. I would encourage you to watch this video, especially as it further explains why dark-skinned people statistically have been struck down with more severe outcomes with COVID-19, quite disproportionately. Dr. Campbell looks at various clinical studies and dosages. I personally believe that vitamin D is a crucial vitamin to take during COVID-19, especially if you are an olive-skinned or dark-skinned person. For example, I would make less vitamin D as I'm olive-skinned than Lawrence, who is rosy-skinned. So even shades of light and dark might be important. On March 8, a more in-depth discussion on vitamin D can be viewed in a link that I'll leave for you below, in particular regarding immunity and how it protects you against respiratory disease in general. Dosages are discussed at a specific point, but in general, 25 micrograms or 1,000 international units is recommended. Now, I take a bigger dosage on alternate days, and you can view another link to inform yourself regarding this from a reputable medical source on March 4 that discusses a study regarding this in more depth. Furthermore, on 21 April, MedCram discussed the findings of the impact of vitamin D that decreases chest infections in some patients by 50%. I will refer to this link again in this discussion with regards to other supplements that show great potential. I would like to recommend that you watch this entire lecture. The latest discussion on 5 May by Dr. Campbell reflects on a brand new study from Indonesia that is specific to COVID-19. Unlike the above-mentioned studies, it actually confirms the aforementioned studies. Another small study on May 7 related to COVID-19 and vitamin D also shows less severe outcomes in patients with a higher level of vitamin D. I will leave the link for you below. An additional link discusses dosages for vitamin D, and I will link this below for you as well. This link will also clear up the confusion of the different ways vitamin D is measured internationally. In short, you should probably take a vitamin D supplement unless you have a comorbidity that prevents you from doing that. If so, consult your personal doctor. A vitamin D supplement could protect you, together with social distancing, good hand and domestic hygiene, and wearing a mask, and could significantly lessen your chances of contracting COVID-19 altogether or in a less severe form. Now, let's look at other immune boosters. Apart from vitamin D and C, I don't particularly favor any of the suggestions on this, as I've mainly seen some case studies reports on vitamin C and clinical studies that are convincing on vitamin D. Vitamin C is the second supplement that I do take daily during this pandemic. It has an established history as a supplement that can shorten a patient's stay in the ICU, even before the pandemic. Now, quercetin. If you're interested in a discussion of medical studies on vitamin C, quercetin, vitamin D, and zinc all in one discussion, then I would encourage you to listen to the link that I mentioned before that could reduce chest infections with 50%. Furthermore, this link describes the personal regimen that this specialist who works with COVID-19 patients goes through at the end of a working day, and it is insightful for both medical and lay people. Elderberry syrup has some clinical evidence behind it. However, I have no access to this in my country of residence, and really a good diet, exercise, good mental health, and some vitamin D or sufficient sun exposure, and C, preferably in food, could suffice. This link that I will provide for you below also discusses the supplement quercetin, which works in a similar way as the drug hydroxychloroquine, which is currently being tried out as a viable treatment for COVID-19 in a variety of studies. Now, zinc. There are some differing opinions on this, as technically it has to get into the cell, and taking tablets cannot facilitate this. However, I do suck on a zinc lozenge, I cannot say that word, lozenge, upon leaving the house and again when coming home, as this has been suggested by a virology expert who had substantial experience, though I now can't remember who it was. He claimed that this can deal with a virus if it lands in your mouth and throat. I have easy access to this, so I do it in case it works. And it's cheap. I have to order supplements online, and parcels do not get past Hong Kong at present, or they get here slowly. So I have simplified my regime for COVID-19 to vitamin C and D, the two supplements with the most established clinical data behind it. Having talked about all these vitamins has made me hungry, so I think I'll show you some more delicious recipes in the future. But for now, I'm going to boost my vitamin intake with a juicy slice of watermelon and a Mai Tai. So feel free to subscribe, comment, share, and like this video. Stay healthy, and I'll see you soon.